You've been told that your blood sugars are too high and you're South Asian. So what do you need to know about HBA1C from your last blood test? Welcome to my diabetes series. I am Ravneet. I am a nutrition, health and wellbeing coach working privately and for the NHS to help you reverse your diabetes or manage your blood sugars and prevent diabetes. HBA1C is the term used to measure the average blood glucose of 2 to 3 months. If your body can't use that sugar appropriately, it will stay stuck to those blood cells. Red blood cells have an average lifespan of 2 to 3 months. So the HbA1c measure is looking at how your body is treating the sugar in your blood and how much is left over or hanging around higher than a certain number of what we would use to indicate pre-diabetes or diabetes. HbA1c 48 and above is categorized as having diabetes. So if you want to prevent it, we'd like to keep you under 42. So 43 to 47 is that pre-diabetic range where the GPs are going to give you a heads up and say, sort it out, let's try and bring that down. I come along with hacks and tips to help you reduce that blood sugar so that in the next test you can see that it's coming down consistently. And we want to see that not just after 3 months, 6 months, but we want to be able to track that at least for a year to know that your body is managing blood sugar and using it appropriately, not storing it in your red blood cells. This can be a lot to take in and a lot to learn, and the GP doesn't always have the time to explain this. So you might be referred to a nurse or a dietitian or someone to help you on a pre-diabetes or diabetes prevention plan. If that's the case, great, you're in luck. If not, you may require someone's help, like myself as a health and wellbeing coach who can educate and inform you on nutritional choices and activities that you can do to bring your HbA1c down, essentially managing the blood sugar, preventing diabetes. So if you or your family members are struggling and you're a little bit thrown by this terminology, drop me a DM, drop me a comment, get in touch. Do not leave it until it's too late. You don't need to get to that diabetes stage, or you don't need to stay in the diabetes stage on medication. You are able to reverse that, as I have done with many patients and private clients. Don't hesitate. Don't be ashamed. Don't be embarrassed. This is really common in South Asians. More on that in another post. And I'd rather you get that help without judgment from a qualified professional so that you can look after your health.